What about getting started with Ohana Care? What does that look like? If I was a client that, was calling, how do we start that care?
It really depends on your situation. As we've seen, every day is different, and every situation is very unique. And we definitely take it in stride. We have the privilege of a large pool of caregivers that are willing to support us and our clients essentially at the drop of a hat. So if you're in a crisis situation, we can absolutely support. In a perfect scenario, we love to have a week's notice to be able to find that perfect match or what we think will be a good match for your loved one. And that buys us some time to find the caregiver, make sure that the schedule accommodates everything, make any small adjustments that we need to do, and also allow our caregiver to do their research and their due diligence to read the care plan, make sure that they know what they're walking into and express any questions or concerns that they may have. So, you make that phone call to Ohana Care. We talk about, what your goals are for home care, what your needs are for home care. We talk about a schedule. We have one simple form to complete. It's all online. We don't use any paper. And once that form is complete, things move pretty quickly. We have a team of admin that work 24 hours a day, 7 days a week, blood, sweat, and tears. And, we want to make sure that we're meeting the care needs when they're needed. So we work pretty closely with you and with the rest of the team to make sure that that happens in a timely manner.
Yeah. So it's an easy start is what you're saying.
Yeah, I mean, oftentimes it is a pretty easy start, and the barrier many times is getting the client on board. We get so many phone calls where mom or dad might be a little bit reluctant to get care. And so we deal with that on an individual basis and work with the family to try and understand what are the hesitations, how we can best support the transition into having care in the home.